Confusion and dementia. This information can be found in Chapter 53 of your textbook. Changes in the brain and nervous system occur with certain diseases and with age. For instance, nerve cells are lost, nerve conduction slows, reflexes are slower, vision, hearing, taste, smell, and touch decrease, sensitivity to pain decreases, blood flow to the brain is reduced, sleep patterns change, and dizziness can occur. Cognitive function involves memory, thinking, reasoning, the ability to understand, judgment, and behavior. Confusion is the state of being disoriented to person, time, place, situation, or identity. With confusion, behavior changes such as anger, restlessness, depression, and irritability are common. Some causes of confusion include disease, brain injury, infection, fever, alcohol, drug use, medication side effects, hypoxia or lack of oxygen, hypoglycemia or low blood sugar, sleep problems, seizures, poor nutrition, and electrolyte imbalances. When a person is alert and oriented times 4, that means they know their name, they know the time or the year, they can describe the place that they are in and the situation. For instance, if a patient is in the hospital after a hip surgery and they are alert and oriented times 4, they would be able to tell you their name, the year, that they're in the hospital and possibly which hospital, and then also the reason for being in the hospital. A person is alert and oriented times 3 if they are only oriented to 3 of the following things: person, time, place, or situation. So for instance, that person in the hospital may be alert and oriented times 3 if they know who they are, where they are at, why they're in the hospital, but perhaps they cannot recall the year. Some care measures for confusion. The CNA should follow the care plan, provide for safety, face the person when speaking, give the patient the date and time each morning, explain what you are doing and why, give clear, simple directions, maintain the day-night cycle. That can be accomplished by opening window coverings during the day and closing them at night, using night lights in rooms, bathrooms, hallways, and other areas at night, and having the person wear daytime clothing instead of pajamas during the day. Finally, the CNA should follow the person's routine. Delirium is a state of sudden, severe confusion and rapid changes in brain function. It is usually temporary and reversible. It occurs with physical and mental illness. There's a fast onset. Delirium signals illness. It is an emergency. The cause must be found and treated. Some causes of delirium include surgery, drug or alcohol abuse, drug side effects, severe lack of sleep, electrolyte imbalances, and infections. Some signs and symptoms of delirium are change in alertness, change in sensations, change in awareness, very active or slow moving, drowsiness, confusion about time or place, decreased short-term memory and recall, changes in thinking, concentration problems, speech that does not make sense, incontinence, and emotional changes such as agitation, anger, depression, euphoria, or irritability. ICU delirium is very common in ICU hospitalized patients due to them having surgery, the medications that they're on, infection, or severe lack of sleep. Dementia is the loss of cognitive function that interferes with daily life and activities. It is a group of symptoms, not a specific disease. It is caused by damage to brain cells. There is no cure, and dementia is not a normal part of aging. With dementia, changes in personality, mood, behavior, and communication are common. Some early warning signs of dementia include memory loss, problems with common tasks, problems with language and communication, getting lost in familiar places, misplacing things, personality changes, and poor or decreased judgment. Alzheimer's disease is the most common type of permanent dementia. With Alzheimer's, brain cells are destroyed and die. Connections between the nerve cells are lost over time. The brain shrinks. Possible causes are plaques and tangles. Plaques are protein pieces that build up in the spaces between nerve cells. Tangles are twisted protein fibers that build up inside cells. With aging, most people develop some plaques and tangles. In Alzheimer's disease, plaque and tangle development is severe. Memory areas of the brain are often affected before other areas. Alzheimer's disease onset is gradual. Usually, symptoms appear after the age of 60. Risk factors include aging and a family history of the disease. Some ways for older adults to maintain cognitive function are to get regular exercise, eat a healthy diet, keep the mind active, control type 2 diabetes, maintain healthy blood pressure, maintain healthy cholesterol levels, maintain a healthy weight, do not smoke, avoid excess alcohol intake, and get enough sleep. Sundowning refers to the phenomenon that the signs, symptoms, and behaviors of Alzheimer's disease increase during hours of darkness. These pictures show the different stages of Alzheimer's disease. Signs and symptoms become more severe as Alzheimer's progresses. The disease ends in death. Alzheimer's disease is described in 3 stages. The first one is mild Alzheimer's disease. Memory loss, poor judgment, loss of spontaneity, taking longer to do daily tasks, repeating questions, problems handling money and paying bills, wandering and getting lost, losing or misplacing items in odd places, mood and personality changes, anxiety and aggression are common. The next stage is mild to moderate Alzheimer's disease. With this, there's increased memory loss and confusion. Patients cannot learn new things. They have problems with language, reading, writing, and working with numbers. They have trouble thinking logically, shortened attention spans, problems coping with new situations, problems with multi-step tasks, problems recognizing family and friends, hallucinations, which are seeing, hearing, smelling, feeling, or tasting things that are not real, and paranoia, which is when the person has false beliefs and suspicions about a person or situation, are common. They may also have impulsive behavior, outbursts of anger, wandering, and repetitive statements or movements. With severe Alzheimer's disease, the patient is dependent on others for care. They're in bed most or all of the time. They cannot communicate. Weight loss, seizures, skin infections, difficulty swallowing, groaning, moaning, or grunting, increased sleeping, and loss of bowel or bladder control are common. There are a couple other types of permanent dementia. With vascular dementia, stroke or other blood vessel problems damage the vessels that supply blood to the brain. With Lewy body dementia, abnormal protein deposits in the brain, or Lewy bodies, affect chemicals in the brain. Frontotemporal disorders occur when nerve cells in certain areas of the brain, the front and the side, break down. Finally, mixed dementia is when 2 or more types of dementia occur together. Validation therapy is a way to communicate with persons with dementia. The person's reality, so what the person thinks is real and true, is accepted. The person is treated with dignity and self-worth. Validation therapy is based on the belief that all behaviors have meanings. A person may have unresolved issues and emotions from the past. A person's mind may return to the past to resolve issues and emotions. Caregivers need to listen and provide empathy. Attempts are not made to correct thoughts or bring the person back to reality. So for instance, a person talks about waiting for the bus to go to work. The caregiver does not say, "You don't work anymore." Instead, the caregiver says, "Tell me about your work."